Something that makes everybody here at NKCD Dental feel really good about selecting Keystone products is knowing that everything that they make is made here in the USA, made and designed here in the United States. So I think we all feel really comfortable giving that to our patients.
Keystone's been around for over 100 years, and they have a variety of different products that we use for all the things that we do. Hi, my name is Dr. Bill Busch. I think one of the greatest things that 3D printing and the other digital technologies offer to dentists is complete control over the workflow. I love my dental lab, but if I can have my dental lab in the office, it makes things less costly. And for the patient's sake, the patients can get most of their dentistry done in half the time, and time is everything to both the doctor and the patient. The traditional, we've got stock mouth guards which just come out of a box and they just go in your mouth. Those are the least expensive. And I'd probably like to have that some form of protection. And then come the boil and bite, which offers a better fit for the athlete, but it doesn't necessarily mean that it's going to fit perfectly.
What kind of mouth guard do you wear right now?
I wear a battle one,
Okay.
just a regular white one.
What do you not like about it?
It's just very thick in my mouth and it falls apart easily, so it's just not comfortable enough. It doesn't fit right.
Then it may affect their performance. So it's not the greatest. And going on to the thermoplastic, and now we're at the next level, which is the 3D printing. We've got a level of precision and fit that hasn't ever been achieved yet. And that's what I'm most excited about. I'm excited about the players actually and athletes getting those mouth guards into their mouth and then letting us know how it feels and how they perform.
I'm really excited for the work that we're doing with Keystone, the way that they're able to help us in office from the start to the finish, the fact that I can 3D print with their products, the alcohol that they provide to wash the product, the finishing kit that they have, even as far as the case that I'm delivering my product into the patient, and the personalization that we can do in, those final steps is really exciting. The mouth guards are a game changer. I'm a parent myself, not only a dental professional, so even being chairside and at home, watching parents do a boil and bite mouth guard for any number of sports for their child, thinking that they're protecting their child, because that's all we've ever known when it comes to protecting the teeth, and seeing what that does to a child, it can do more harm than good. My son, we did a boil and bite mouth guard last year for football, and he ended up not telling me that it was uncomfortable and wasn't fitting right. Seeing kids here in office that wore a boil and bite mouth guard thinking that it was going to protect their teeth, they're wearing it, and something happens on the field and their teeth aren't protected, and their parents are like, well, they were wearing a mouth guard. Well, they were wearing a mouth guard that didn't fit their mouth properly, that didn't cover their teeth properly. Even from a parent standpoint, I would much rather invest in a mouth guard for my child than have my kid come off the field after an accident and they're missing their front tooth, or they need a root canal now, and they're so young. To go through that trauma dentally it's a big difference to be able to protect them from that. So I think the most exciting part about using Keystone products is the fact that we do have multiple printers here in office. We have different platforms. Using Keystone resins are a big part of our 3D printing journey. So knowing that I can use their resins across multiple printers, multiple platforms is so convenient for us.
Keystone's kind of like the grocery store for me for the materials that we need for our dental lab, and we've always used them. I've been so happy that we've been able to participate with them over the years.